This is a videotape on addictions. Addictions is the behavior intended to reverse a profound, intolerable sense of helplessness. This helplessness is always rooted in something deeply important to the individual. Because having an addiction is not the same as being impulsive. This is another common myth. Because addressing feelings of helplessness is the key to treating addiction. Since the things that set off urges to perform an addictive act are always related in some way to something very important to you, it turns out that you can figure out this underlying theme if you have also figured out something essential about yourself. The drive in addictive behavior is rage at helplessness. It is this particular kind of rage that gives addiction its most conspicuous characteristics of intensity and loss of control. Addictions are all substitute or displaced actions. They take the place of a more direct response of feelings of helplessness in a particular situation. If you compulsively substitute drinking for a direct action, then we say you have alcoholism. If you substitute sex, then we call this a sexual addiction. If you substitute compulsive eating, then we call it a type of eating disorder, and so on. How to know if you have an addiction? Habits, physical addiction, the most common misunderstanding of addiction, the brain disease model, neurological illness called the chronic brain disease. This idea comes from experiments in which rats were given large doses of narcotics for a long time, and then we found to seek more of the drug, even when simply exposed to cues that had been associated with the drug. It's a conditioned reflex, Pavlov's famous experiment in which the bell rang every time a group of dogs were salivating when the bell rang, even in the absence of food. They are conditioned to respond to the bell alone. Other causes of behaviors that look like addictions: relationship pressure, special settings, and adolescence. How to think about yourself if you have an addiction. If people believe that addiction is due to being physically hooked on drugs, they may believe you created your own addiction. If people believe that addiction is a chronic brain disease, then they must consider you very different from themselves. If people believe that addicts are weak-willed, stupid, or lazy, or they may be stigmatized by those views, the psychological mechanism at work in addiction, as they hope is clear, has nothing whatever to do with weakness, stupidity, or laziness. The fact is, if you suffer with an addiction, you are not different at all from anyone else. The drive in addiction is normal. Addiction is just compulsions. Addictions don't mean you're sicker than anyone else. Treatment for addiction is no different than treatment for any other psychological symptoms. Recognizing the key moment in addiction. Don't focus on your addictive behavior itself. Follow your behaviors back to the key moment. The key moment in addiction is when the thought of it first comes to mind. This may be hours or even days before the addictive act occurs. The key moment in the chain of thoughts, feelings, and acts leading to an addictive behavior may be a decision to take an action that brings you closer to the addictive behavior rather than a conscious thought about the addictive act itself. How to keep yourself from seeing the addiction ahead of you. Understanding what is happening at the key moment in addiction. We've seen that it doesn't make sense to spend time looking at the effects of addictive acts, and it isn't much more useful to spend energy focusing on addictive acts themselves. We know that the key moment in an addictive process is always earlier, but sometimes much earlier than when you actually do your addictive act. We also know that the key moment can be hard to find and that you may even defensively conceal it from yourself. The feeling at the key moment along the path to addictive behavior is helplessness or powerlessness. It feels like you are in a trap that you can do nothing about. Short-term strategies for dealing with addiction. The solutions to the helplessness traps that lead to addiction are just the direct actions that would have automatically come to mind if there were not some emotional factor preventing you from acting directly. When seeking alternatives to addictive behavior, you don't need to come up with the best possible alternative. You only need to come up with an action that addresses your predicament more directly than the addictive act. Focus on your feelings, not the external reality. How to find short-term solutions in more complex situations. Because it is so valuable to recognize the key moment, the earliest point at which you begin to think about performing your addictive act. You can help yourself by imagining this moment yourself. You can do this by anticipating the circumstances in which it would occur. Anticipation. How to deal with addiction in the long term. Step 7. Four ways that being an expert on yourself enables you to deal with addiction forever. Predicting recurrence. That's the first way. Stepping out of the trap in key moments. Understanding your life and turning the tables on your addiction, using it to become an expert on yourself. The key factors to ask yourself to test yourself about addictions are: number 1, what are the underlying emotional themes that lead to the experience of helplessness and in turn its addictive solution? What defenses does this person use to keep him or her from seeing the key moment? What is the key moment in this person's path to addiction? What more direct alternative actions could he or she have taken in place of the addictive act? And that's the end.